Hello, everybody. This is Gary. Today is January 30th, 2023. It is 2:10 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today, my anxiety levels are very high. My paranoia and delusions are not that bad. My auditory hallucinations are present, but they're very much at a bare minimum. My depression is pretty severe. Um, I am still worried about having pulmonary fibrosis, which is scar tissue developing in my lungs, which makes it more difficult to breathe whenever I walk or strain or exercise. I get out of breath very easily. I was diagnosed with pulmonary fibrosis a couple weeks ago, and I was going through my medical records online, which I have access to through something called MyChart. Um, and it showed the CAT scan that I had of my abdomen, showed my lower lungs have scar tissue in my lower lungs that makes it more difficult for me to breathe, and that scar tissue develops in the air sac of the lungs, and it's called pulmonary fibrosis. It could get worse depending on what causes it, and we don't know what causes it. It's often caused by different chemical irritations, breathing in certain poisonous chemicals. Chemotherapy for cancer can cause it, but I don't have cancer and I've never had chemotherapy. But I'm seeing a pulmonary specialist on March 28th in a couple of months, and they will test the strength of my lungs, and I will talk to the specialist about where do we go for treatment options and what are the treatment options. I haven't had a cigarette in 12 months, and the interesting thing is I already had a lung screening CAT scan for cancer, and it showed there was no cancer, but it didn't show any pulmonary fibrosis. The pulmonary fibrosis showed up on a later CAT scan of my abdomen, which was done to check for internal bleeding. They didn't find any internal bleeding, but they did find the pulmonary fibrosis. Pulmonary fibrosis may or may not get worse. It may spread slowly. It may spread fast. It depends on what's causing it. I'm not sure if my use of too much bleach to clean my apartment has irritated my lungs and damaged my lungs. My primary care provider said it's a possibility. I can't think of anything else that would cause it. Cigarette smoking, I haven't had a cigarette in 12 months. I suppose it's a possible cause, but I haven't had a cigarette in 12 months, and it did show up in the CAT scan of my lungs I did for screening for lung cancer. Um, I don't have lung cancer. That did not show up in either CAT scan. Um, so my anxiety levels are very high. When I first found out that I had pulmonary fibrosis, I looked it up online, and a lot of the websites said that the life expectancy is 3 to 5 years, but that's dependent on a lot of different things. Um, I saw my primary care provider. She did say I have extremely high blood pressure, and so she put me on a third blood pressure medication. So now I'm on 3 different blood pressure medications. And my heart rate was very rapid. It was 117 beats per minute, and the blood pressure medication is designed to lower my heart rate. Um, so I'm going to see the pulmonary specialist in about 2 months, and I will see my primary care provider again in 3 months when I know more about what the hell is going on with my lungs. But all this stress puts more pressure on me psychologically, making my psychiatric symptoms worse. My paranoia is worse overall. My delusions are worse overall. My depression and anxiety are worse overall. My auditory hallucinations get more intense from time to time. I am seeing my therapist on Thursday, and I'm seeing my psychiatrist on Friday. So we will be discussing all of this with them. Um, I'm just trying to stick to my daily schedule. I already went out for my daily walk and physical exercises. I went food shopping. I did some work on my computer. I'm making these videos. I'm already meditated twice today, and I'll meditate later on for anxiety. I meditate 3 times a day to help control my paranoia, my anxiety, my depression. Um, it doesn't really affect my auditory hallucinations that much, one way or the other. Um, but I find meditation useful, especially in controlling my anxiety levels. So I don't think my psychiatrist will see any reason to change my medications. The only other thing my primary care provider did was give me a steroid cream because I had a weird rash developing on my right arm that wasn't showing up anywhere else on my body. She didn't say what caused it. She was pretty sure it's not scabies. I've had scabies before, but the rash is pretty much under control. Whatever caused it seems to have went away. But like, comment, share, subscribe.